Hey guys, welcome back to another episode of TheNShow, a podcast channel where we spread ideas, motivation, creativity, personal belief, and much more. In each episode, we are joined with a special guest and they will be sharing with us their story and experience. I hope you guys will enjoy our episode this week. Alright guys, welcome back to the show, and today with me, my guest is Wendy. So welcome, Wendy.
Hi everyone. Hello Naveen.
Hey, sup? So
Hello.
really grateful to have you today in our show. And can you maybe like introduce yourself first?
Okay. As you know, my name is Wendy. So today topic is going to be talking about my job as well as my life in COVID quarantine. So basically, I'm working as a medical sales representative slash orthopedic technicians. But this job is not much people knowing that this job because most people know that salesperson normally they just conducted sales job in meeting clients,
Yep.
having a sales talk, but not much of people knowing that a salesperson can actually perform and technical solving in operation theater. So today I'm going to be showing you like roughly what am I doing this job.
Okay, so thanks Wendy for the introduction. And basically you guys heard that today we're gonna talk more about like medical sales representative and what is her job and so on. And actually before we get into it, like just want to ask, because like you got the COVID-19. So like how has your day been, in like a quarantine center?
Basically nothing much. It's just like a normal day. You are in your room, basically doing the things repeatedly, like studying, because I also besides also taking a bachelor in psychology in OUM University. So basically my day of life would be studying, workout, and do the daily checkup as required by the KKM, as well as talking with my friends, having with my friends, and repeat.
I see. So from what I see, I think your like your COVID situation is not that serious, right?
Yeah, not that serious because basically I'm asymptomatic. So that's why it actually is very dangerous when you are asymptomatic. You
Correct.
don't know whether you carry the potential to spread this COVID things to others or not. That's why I think it's better, to take care of our own hygiene as well as following all the SOPs.
Definitely following the SOP, definitely. But in our country, some people don't follow. And
we can't talk about that.
basically, we can't talk about that. I don't want to go jail. And
Okay.
actually, how long have you been like getting like this COVID thing?
You mean how am I know I get contacted with this COVID?
Yeah.
Is
Correct.
it what
like,
you mean?
Yeah, correct. Like how do you know, like when you started like, hey, I think I have it lah. I think I have it. Yeah.
Okay, basically how am I know that I getting COVID positive is because like I'm contacted with one of my cousins. Apparently she was tested positive, and I think for my own safety as well as my family safety, I have to go on and get some the rapid test, which is the RTK test, and then I can get the test immediately within 15 minutes. But after getting the test, I was tested positive. I was getting positive. That's why to ensure whether I'm really accurately positive. So sometimes you will get a false positive from the result.
Correct.
So I will do another PCR test. So the PCR test might take around 2 hours to get the results. And then afterwards, I was getting the PCR test, also getting positive result as well.
Right. So during that time, when you get like a COVID, right? Do you feel like do you have any
Anxious?
like anxious or anxiety attack that, oh shit, like I got COVID and what's gonna happen to me? Yeah.
For me it's like this is very quite subjective, because for me it's like I think COVID, this kind of thing is quite common. Even though we follow all the SOP, but sometimes we will still get infected, we still get contacted with some of the people which is showing no symptom. So for me is, instead of worrying about like, oh, I getting COVID things or how am I supposed to do, why not you just adjust your mindset and going to think like, oh, what am I going to do next during this quarantine time?
Right. But with like the COVID situation now in our country, it's I would say that just like take care of yourself, and you just really have to follow all the SOP, because our country have really like a shortage supply of like beds in the hospital. And if
Yes, yes.
supposingly like you're not supposed to get COVID, for example, like let's say if you follow SOP and all, but you don't want to follow that, then you go and meet your friends and all, and you get the COVID, then it's like wasting the supply of the hospital, because you're not supposed to be there if you have followed the SOP. So I think that's like a very important thing. So
Yeah, you're right. Besides just giving you some of the info, like apparently in the general hospital in Malacca, now there are so shortage of the oxygen supply. That's why this is very important. It's at an alarming state. Yeah, this COVID
correct,
thing is very, very serious. Like
correct.
even though you are following SOP, the best is not contact any person. The best is just stay at home.
Yeah,
Even though like like it's your relative, like she might be doing all the SOP, like doing all her hygiene routine, but sometimes we just get contacted without knowing it because it doesn't show any symptom. So I think the best is we just stay at home and get less contacted with the people.
yeah, it's true. Like what you say. Some people might be like positive, but then they don't show any symptom. Like they are just fine, and they don't even have like flu or what, and they're just fine. And then we go and meet him, and then we talk, then we get the positive, right?
Right.
And also I just like want to curious, like because when you get positive, then you have to go and like register yourself, right, at the COVID center or something. What's the situation like
you're
that?
speaking about
Yeah.
Okay, you're speaking about the process, right?
Yeah, yeah.
Basically, once I was getting positive by my first test, the RTK test, the rapid test, and then I was immediately moved out to another. I have another house. I moved out to another house to do my quarantine away from my family. And as I was like waiting for the KKM to report me, they update me through the My Sejahtera apps there. They were showing you, oh, you're now a COVID positive patient with no symptoms showing. So, and afterward, you have some tasks you need to do. Every day you have to report to the KKM. You have to do the questionnaire. They will ask you like, do you show any symptom, sign of symptom? Is there any CSC? Yeah, is there any CSC department contacted you? You have to do the assessment up until if I'm not mistaken, 10 days. It's not 14 days. The 10 days, the quarantine days, the 10 days you have to following all the rules and the requirement that they need to submit all the updates to the KKM. And I was getting contacted by one of the CSC department, one of the person that contacted me 2 days after I getting positive. They asked me to go to register to this clinic kesehatan in Batu Berenang, which is a place in Malacca, as you know. And after that, the situation basically is like very, very crowded. Normally,
right.
I mean, like, yeah, it's very, very crowded, and a lot of people actually queuing up, not just adult, like I also seen the children, like under 5 years old, also getting COVID positive.
I see. So, and recently I've seen like one news where they set like this kind of like COVID registration place inside the housing area. I think it's in like Selangor. I think it's like Selangor, where all these like COVID people, they will queue up in the housing estate, and first thing, there's no parking in like housing area, as you know. And the second thing is they are all COVID positive, and they are all lining up, constantly like lining up, and it's creating like a very long line, and everyone is like very panicked in it. Yeah.
I think it's because like I'm not sure whether what's the situation in Selangor. Maybe they don't have a standard clinic for them to actually register this COVID patient. But for me, I'm currently staying in Malacca. So for Malacca, they actually have a COVID assessment center whereby there's all of us, we will drive through to the assessment, the tent there. There's a tent, and then they will assess you through drive through. I think it's safer you drive through, not just queuing up by people, and you will get it will get very crowded, and people will get intercontamination is very, very serious.
Yeah. By the way, just want to ask, have you gotten like your vaccination jab?
Okay, to be honest, I haven't gotten my vaccinations
I see.
jab, but my company already registered all our employees, but we're just waiting for the appointment because like according to my employers, they told me it's because like they want to clear out the factories workers first, only until our terms.
Mm. Wait, but you got like positive, right? So is there any like SOP to follow? Because like, because you got positive, or is there like a period for you to wait until you only can get the jab or can straight jab after you're recovered?
Basically, if let's say you want to get any vaccination, not just COVID vaccination, you have to be in a healthy state first in order to
Mm.
get any vaccinations. So back to your question saying that if let's say I get COVID, can I get vaccination? Of course, I can't get vaccination. I have to postpone my appointment to the next day. So quarantine session finishing, I will be arranging the appointment soon.
Mhm. I see. So it's like you have to wait long, correct? You have to wait until like you are fully
Yeah, we
recovered, or
have to
there's
wait.
a or there's like a certain period of
Yes,
time.
definitely.
Right. So yeah, I think that's it for like the
Yes.
vaccine side. And okay, just a quick question, before we proceed. Like how's the food, in like the quarantine center?
The food was so-so, but let's just not talk about the food.
Yeah.
Let's just talk about like how we get the food from our room because it's like I think it's slightly different. Okay, from like usually the normal day, before we get in the quarantine center. Like if you let's say you're in a quarantine center in a hotel, you want to get your food. It's not just you need to go down to the lobby. You have to wait until the broadcasting. They will inform
Mm.
you like, oh, your food is ready. Basically, you can't just going outside as what you like, and then you can't go down to the lobby and just for a
Mm-hmm.
walk. And this is really not allowed lah for this quarantine center.
Right.
Mm.
Yeah, definitely. So I think, Malacca healthcare has been like keeping up with like the COVID patient very seriously, to ensure like everyone's safe, and we can go back to like normal hopefully. And just now, in the introduction, you mentioned that okay, you're a medical sales representative and also a orthopedic technician.
Yes.
Maybe like the people listening don't know what is that? What is a orthopedic technician? Can you explain it, like what,
Okay.
maybe like what do you do like in a day? Yeah.
Okay, let me just tell you about what do we mean by orthopedic. Orthopedic is actually a medical term. Okay, to be simplified, it's simply called a bone technician, which means like we're doing something dealing with a bone of the patient, like related to the fracture and what is it, the implant, as you know. Okay, so basically, I'm the person who's selling the implant to the doctor.
I see.
So the implants actually imply on the patient's fractures. Basically, like from what people know, that they know about medical sales is like from the pharma line, from a pharmacy
Correct.
line. Yeah, from pharmacy line, or they just dealing with the some of the distributor as well as some of the purchasing order officer in order to deal with some of the medications and inventory, everything. But for my side, we're not just doing that. We have to go to the operation theater, which means we have to sometimes we have to assist the surgeon in the sense like we telling them like what are the system or the instrumentation that require during the operations theater, if let's say they uh using or order the implant from our company.
Mm, I see. Okay, I get it now. So basically, you are like from a company. So your company like actually supply all these like implant to actually
Implant.
help
Okay.
to fix like the fractures from the bone, right?
Yes.
I see.
You're
So
right.
yeah, guys. So that's like a basic explanation of what Wendy's job scope is. So yeah, it's pretty amazing because when the first time we know each other and you told me about this, I really did not heard or did not know that there is such thing like that. Because like you say, everyone knows just like, okay, if you're a doctor or you're something dealing with a medical line, means okay, you're with pharma. Yeah, it's really like it's a new thing for me. Knowing about orthopedic technician. And people will say, right, wow, medical line very busy, or very, very busy. So maybe can you run us like a day through, like, let's say, for example, like let's say if you don't have like COVID-19 now, what would a
Okay.
day in your life be? How would your day look like? Yeah.
I can tell you, it was super, super busy. Okay. You know, right? When you want to talk to me, you don't even have the time to even talk to me. You know, it was
Yeah.
like really, really busy. Okay, the day of my life is like, okay, the first, if let's say there's no any cases schedule, there's no any operation schedule on the next day. Normally, the day of my life, I will be going to the office. I will be doing some of the office job, and then afterward, I will be collecting some of the set. We call it as a set lah. In short, is the instrumentation and the implant sets. We will together put inside the set. Okay, and then I will be checking on the set and make sure everything is in the set, and I will bring it to the hospital. So basically, the hospital, the territory time is in Seremban and Baptisan. So I have to prepare all the set instrumentation things, and I have to carry to the Seremban there, and then Seremban hospital basically, and show it to the surgeon. Like doing basically, I'm doing the sales call. Okay, I will make an appointment with the surgeon, and I will show like, oh, this is the instrumentation or implant that our company have. Then I'm here to actually paying you a visit to show you like what are the implant availability in our company. So yeah, basically we are just doing a sales call. We will just read the surgeon, and we will bring them our lunch if there's no COVID. Okay, I'm saying let's say there's no
Yeah.
COVID, we will bring the surgeon out for lunch. Yeah, yeah, yeah. Things before COVID are pretty amazing now. Okay,
Yeah.
so yeah, I'll bring the surgeon out for lunch, and then yeah, talking about business, everything, and then this is just like if let's say there's no I mean surgery schedule. Okay, if let's say there's any surgery schedule, okay, the life will be totally different. Okay, as you know, like
Absolutely.
from the Seremban, yeah, as you know, like in the Seremban hospital, the territory I was assigned, let's say there's a surgery schedule on that day, I have to attend. If let's say it's scheduled on the in the morning, it's pretty perfect. Like I can finish it earlier, and can go back my home straight away. But if let's say they were scheduled on the afternoon, yeah, things will be pretty uh
Hectic lah,
difficult for me
right?
lah.
Yeah.
Yes, very, very hectic. It's like, let's say it was scheduled on the afternoon, sometimes like there's some complication, some
Mm.
complication happening for the case before my case turns. Let's say the patient have any complication, my case has to be postponed until maybe at the evening or even at the night, because the operation theater, their running time is 24 hours.
Mm.
So
Of course.
basically, I'm not sure. Yep, this is not all the hospital will be 24 hours, but
Yeah.
just the territory I was assigned was 24 hours. Okay, so if let's say my case have to postpone until the night. Okay, if let's say the surgery start at 8 p.m. Okay, normally they will be depending on this complexity of this surgery. Normally they will do around 3 to 4 hours. Let's say I was the case start at 8 p.m. So it will be roughly around 12 p.m. 12 a.m. Sorry,
Yeah,
I'll
12
be
a.m.
finishing my case. 12 a.m. I'll be finishing my case. Then imagine I was in Seremban. I have to travel all the way from
Right.
Seremban back to my
Malacca,
Malacca.
yeah.
So it's I can say it's very, very hectic.
Of course.
It's not an easy job, you know. It's like you need to have a lot of commitment in it.
Okay, yeah, thanks Wendy for the answer. And actually just curious, right? As like a young adult now in your like 20s, your friend might be spending time with their friends and doing like what young adult do, but what is like the motivation, like behind like whatever you are doing? Yeah.
Okay, you're speaking about my purpose of why am I choosing this career, even though
Correct.
even though I knowing that the fact that it will be very, very hectic, right?
Correct. And you're
Okay,
only in your
the
20s.
okay, the reason why okay, you want to answer your questions. Okay, actually this job was what is it, recommend by my cousins, and then she invited me to join this job. And when I started this job, it's actually kind of very, very new to me, because I was very, very unfamiliar with all the implants things. It's like, oh, what is this things have to be fixed on the fracture side. I was like totally have no ideas on this kind of thing. That's why the interest kicks in. Like my interest kicks in is because like the curiosity like, oh, why is this working, and why it is implied on this kind of fracture, what does not imply on this others kind of fracture. When this curiosity kicks in, and I was keen on keep on looking on the solution, or maybe keep on looking on this the reason why they choosing this kind of implant instead of the other solution. Like all this, I get to experience the things that I was because I previously I wasn't getting this kind of this experience before. That's why I think it's a very, very interesting, and it's a very, very special opportunity that my cousin offered me.
I see.
Mm.
I guess I think yeah, that's just like why like a lot of people are interested in science is because that science we get to try a lot of things. We can fix things here and there, and it like blows our mind, and we like get interested in it. Yeah, so I think yeah, like what you say, like keep on learning and being curious. It's really like going to help you in the long run because like you open up to more opportunities. I mean, I bet like when you just finished graduated from your SPM, you wouldn't know that you'll be doing this today without you actually
Yep,
like yeah
correct.
like being curious or what because like being in the medical line requires a lot of like sacrification in terms of your time, your normal life, your family and your loved one and so on. So I think that's really like really brave of you to really like step up yourself and to explore it yourself. So yeah, and respect lah, frontliners.
Thank you. Thank you very much.
Yeah. And because also you definitely you always have been in the hospital for when you ever started your job. What is it like, being in that kind of like environment, in like a hospital environment?
Basically, I get to know a lot of people over there, because like you're not just keep in touch with the doctors, you also keep in touch with the staff nurse, with the medical assistants, and sometimes the radiographer. Everything is like you get to know like different background of the people, and you get to it's very interesting, like oh, this kind of job existed like in the world. I was
I
like thinking
see.
like in the surgery room, I thought in my concept is that, oh, there's a nurse and a doctor, that's all. But there's more than that, like you have a radiographer, because I'm doing in the orthopedic line. That's why X-ray is very, very is required during this operation. And besides, you also have a medical assistant, and sometimes you have coordinator, like a lot of different kind of job person appears in the one single operation theater room. So it's actually I can get to know a lot of background for people and get a chance to talk to them.
Yeah, absolutely. Yeah, absolutely right. Because like when our environment change and everything will change like basically like the way that we see things, or like there's
Right.
new thing for us to learn.
Yes.
And
Different kind of perspective they holding.
yeah, correct.
Mm.
And also because like you always like travel to hospital, right? When like this thing or this pandemic or this virus started, right? Was your parents
Mhm.
like worried about you, or
Eh,
did they ask you to stop, because it's like too dangerous or something? Yeah.
Okay, that's a very good questions about it. My parents did worry about me, but this is my job to assure them not to be worrying of my
Mm.
this job everything. So my solution was, every time I get back to my home, I will just straight away soak my clothes and everything inside a basin with putting some of the Clorox as well as the soap, to ensure like, oh, I was
Yeah.
clean before out from my room. So yeah, yeah,
Yeah.
it's very, very important to keep your family in safe lah.
Mm.
Mm.
I guess you just have to make them like feel secure, I guess, and not worry
Yes,
about you.
yes,
Right.
yes.
And also, earlier in the show, you mentioned that you are actually still pursuing your bachelor degree in psychology.
Yep,
So,
yep.
studies,
Correct.
especially like psychology also require a lot of time for you to study. How are you balancing these
Yes.
things, within these two things, like, your work and your like normal life?
Okay.
Yeah.
Okay. This is very, very good question. Speaking
Mm.
about that, that's the importance of time management have to kicks in. That's why I'm choosing part-time study, which require me to do my studies only on the weekends. So during the
Oh,
weekdays,
I
I can
see.
still, yes, yep. During on the weekdays, I can still, go on to my normal life. I can still go to work fields, and meet my colleague, everything. And then on at the night or at the weekends, I can still pursuing my study during my free times. I think
Mm.
it's I think for me, it's very important to acquire your experience as well as gaining all your knowledge all at the same time. Provided that you have a time management, good time management, but it's not easy to say than done. Time management, you need to try and error. Sometimes like
Right.
it's not just like you learn it through next day you will know, oh, what is time management. You have to experience it, like, oh, you have to know what is your priorities. You have to schedule accordingly.
I see. Thank you for the answer. That's a very good answer. So, as you can see, she's actually very, very busy, and she still in the same time managed to study, for like her bachelor degree. So, I mean, that's like crazy impressive, like, because not everyone, who is working gonna like think of like pursuing back their bachelor degree, So I think that's a really great one, for yourself, and to have like this kind of mindset takes another level to pursue it. Yeah. Okay, so we are gonna end the show now because we have been talking for quite some time, and I think it's really been a wonderful show, a wonderful talk today with you. And definitely the audience listening definitely get a lot of insight from your line of orthopedic technician, and what is medical sales rep, what is orthopedic, and so on, and how to manage your time, and also your experience with COVID-19. I mean, that's like crazy, and you're still like being positive and keeping up like your energy, and whatever like you said today is really like gonna be very, very valuable for the listeners. So yeah, once again, thank you for coming here. And
Thank you for having me as well.
Yeah, of course. And before we go, before we end this show, would you like to say like any last words to the audience out there listening?
Okay, to in short, like for me, I think it's there's a will, there's a way. Like whenever you want to do something, when you really want to get something, you definitely have your way to get it. So yeah, so keep it up with all your spirits and definitely find the things that you're passionate on is very important as well.
Right. All right. Thank you, Wendy, for the last words. And I hope you guys out there listening, really enjoy what me and Wendy, have been talking about today. And I hope you guys have a great day. Please take care, stay safe. And I'll see you guys in the next episode. Bye-bye.